Our bodies are in a constant state of change. Cells grow, divide, and die in a highly regulated manner. Sometimes, these processes can go awry, leading to abnormal tissue changes. While these changes can be concerning, it's important to remember that not all of them signal cancer. Many factors can cause cells to behave abnormally, including inflammation, injury, and even certain medications. In many cases, these changes are benign, meaning they are not cancerous and do not spread to other parts of the body. However, some tissue changes can increase the risk of developing cancer. It's crucial to understand the differences between these changes and to seek medical attention if you notice any unusual growths or changes in your body. Early detection and proper management are essential to prevent these conditions from progressing to cancer. Remember, knowledge is power when it comes to your health. Hyperplasia is a common type of tissue change characterized by an increase in the number of cells in an organ or tissue. This increase in cell number can cause the affected area to become enlarged. Hyperplasia is often a normal physiological response to a specific stimulus. For example, when a woman is pregnant, hormonal changes cause the cells in her breasts to multiply, leading to breast enlargement. This is a normal and temporary form of hyperplasia. However, hyperplasia can also be caused by abnormal stimuli, such as chronic irritation or inflammation. For example, people who smoke often develop hyperplasia of the cells lining their airways. This is because cigarette smoke irritates the lining of the airways, causing the cells to divide more rapidly in an attempt to repair the damage. While hyperplasia itself is not cancerous, it can sometimes progress to dysplasia, a more serious condition. Dysplasia is a more advanced stage of abnormal cell growth than hyperplasia. In dysplasia, the cells not only increase in number, but also become abnormal in size, shape, and organization. These abnormal cells are not cancerous, but they have the potential to become cancerous if left untreated. Dysplasia can occur in various parts of the body, including the cervix, skin, and lining of the digestive tract. It is often graded on a scale from mild to severe, depending on the degree of cellular abnormality. While mild dysplasia may resolve on its own, moderate to severe dysplasia often requires treatment to prevent it from progressing to cancer. Treatment options vary depending on the location and severity of the dysplasia, but may include medications, surgery, or other procedures. Section 4. Dysplastic nevus. A common example. One common example of dysplasia is a dysplastic nevus, also known as an atypical mole. Moles are very common skin growths that are usually harmless. However, some moles can develop abnormal features, such as irregular borders, uneven color, or a larger size. These atypical moles are called dysplastic nevi. Dysplastic nevi are not cancerous, but they have a higher risk of developing into melanoma, a serious type of skin cancer, than ordinary moles. Therefore, it's important to have any suspicious moles checked by a dermatologist. Regular skin self-exams and annual skin cancer screenings by a dermatologist are crucial for early detection and treatment of dysplastic nevi and other skin cancers. Section 5. Carcinoma in situ, a red flag. Carcinoma in situ is a precancerous condition that represents the most advanced stage of dysplasia. In carcinoma in situ, the abnormal cells are confined to the layer of cells where they originated and have not yet invaded surrounding tissues. Although carcinoma in situ is not considered cancer, it is often treated as such because it has a high likelihood of progressing to invasive cancer if left untreated. Treatment for carcinoma in situ typically involves removing the abnormal cells surgically or destroying them with other methods, such as cryotherapy or laser therapy. Section 6. Vigilance is key monitoring and prevention. Tissue changes are a normal part of life, but some changes can increase the risk of developing cancer. By understanding the differences between hyperplasia, dysplasia, and carcinoma in situ, you can make informed decisions about your health. Regular checkups, screenings, and self-exams are crucial for detecting these changes early when they are most treatable. It's also essential to adopt a healthy lifestyle that includes a balanced diet, regular exercise, and avoidance of tobacco and excessive alcohol consumption. Remember, early detection and prevention are the best weapons against cancer. By being vigilant about your health and seeking medical attention when necessary, you can significantly reduce your risk of developing this disease.